Hello, my name is Kimmy Sear, and I'm doing a presentation on Colorado tick fever. Some general information: the genus of the virus is Cultivirus. The species is Colorado tick fever virus. It is non-enveloped, double-stranded RNA. It's icosahedral in shape, about 80 nanometers, and the incubation period is 1 to 14 days, with the average being like 3 to 4 days before you actually see symptoms. So transmission, like the name implies, the disease is transmitted primarily through a tick called Dermacentor andersoni, or commonly known as the Rocky Mountain wood tick. And scientists have found the virus in other ticks, but they haven't found any others to actually transmit it to humans. So this is the only tick to really be worried about for this disease. It's also been found to be transmitted once through a blood transfusion, but only once, so it's not really a huge concern, because if you have the disease, you avoid donating after you get it. So with this tick, here's some pictures of it. I got the larva, nymph, adult male, adult female. They have this creepy little design on their backs. These things can actually survive up to 600 days without food as adults, which is absolutely crazy. So with the ticks, how it's transmitted, the larvae and nymphs, they prefer smaller hosts. So they'll feed on small rodents like squirrels, chipmunks, stuff like that. And if they feed on an infected one, then they'll carry the virus. And then once they reach adulthood, they see a tasty human running by, and they bite the human. That's how it's transmitted to the human from an infected adult tick. And it's really only adult ticks, just because they like larger hosts, and the smaller ones will mostly feed on the smaller hosts. So that's why it's mostly adults. And since it's only transmitted through this tick, you'll only see this really in the Rocky Mountain area, and up into Canada a little bit, like Alberta and British Columbia. So you see the light blue is where they find the tick to be present, kind of just where it lives, its general area. And the dark blue is actual reported cases where they've been found. And so you see a couple out of the range of the tick. You can probably just assume that it was a traveler that went back, or carried the tick with them maybe, and that's probably why it's out in the weird areas out there. So you mostly see these cases come up late spring to early summer, just because that's when the ticks are most active. Also, when people are most active, they'll be, going outside, hiking, being outdoors a lot more, and so that increases your risk of getting a tick bite and getting the disease. You'll also see more men infected than women, probably just because more men go outside, go hiking, and stuff like that. So from 2002 to 2012, there were only 83 cases reported to the CDC. This is thought to be really, really underreported, mostly because it's not a very deadly disease, and you don't really need to be hospitalized for it. You can pretty much fight it off on your own at home. So that's just why they think there's not a lot of cases reported, because also people don't really know. It's just like a fever and stuff like that, so they don't really report it or anything. So signs and symptoms, you'll usually see fever, chills, body aches, general feeling of lethargy, just really tired, and stuff like that. Less common symptoms include sore throat, vomiting, abdominal pain, and skin rash. And about 50% of cases have a biphasic fever, which is just where you'll get the disease, and then you'll have a fever, and you'll be feeling really bad, and then you'll feel better for a few days, and you're feeling really great, and then you get hit with a second wave, a second fever, or just feel really, really cruddy again. So it's just a two-phase fever. Usually, people will have a complete recovery from the disease. Children, they'll get the disease, and then they'll be better. Usually, people are better within 2 weeks after contracting the disease. So it's not very long. It's not too bad. But with adults, you don't really see this with kids. But with adults, you'll see a lot of them will have weakness after they recover from the disease for a couple months. They'll just get tired really easily, but it eventually goes away. In really rare cases, the central nervous system is affected, where you'll sometimes see neck stiffness and even confusion. But again, not very common, so it's not a huge concern. Death is not common at all. There are only, as of 2009, only 3 deaths ever reported, and they were in children. Probably just had really bad immune systems, couldn't really fight it off. And so I guess that's why they died of it, something like that. There are some complications that can come from having this disease. You can get encephalitis, meningitis, hemorrhagic fever, so kind of the more serious side of the disease where you probably would actually need to go to the hospital. This only occurs 3 to 7% of the time, so it's not a big concern really if you're healthy. So treatment, there's no vaccine for this. Again, probably because it's not really life-threatening, so it's not a huge concern to not have to get it. There are no medications for the infection, so no antivirals or anything. Only about 20% of people are hospitalized for this, and when they are, they'll usually be given intravenous fluids and medication for pain and fever. And then, so the virus can stay in your red blood cells for several months after you've rid yourself of the disease, or that several months after you feel better. Because the virus will be in your red blood cells, and so you're not supposed to donate blood or bone marrow, just so it doesn't get transmitted like that one case. But other than that, you're pretty much considered immune to it after you get it once. So go outside, get bitten by all the ticks you want, as long as they're the Rocky Mountain tick. So obviously, when you get it, if you look at the picture, you want to remove the tick, because that can cause problems if you just leave the tick. Also, that's gross. I read that some people recommend, like there was an old way of taking them off where you would put a flame to like the bottom of the tick. Not recommended. It's a really bad idea because the tick will probably eventually let go and freak out and die and stuff. Before it does that, it'll regurgitate some of the blood it has, and with that, the virus or anything it's carrying. So you're a lot more likely to get a disease if you do that to a tick. So the only really recommended method is to take tweezers and get it in real close to the tick like it has in the picture, and then just kind of pull straight up on it, and hopefully get the head out as well, because that can cause a problem if the head stays in. If it is ripped off, you can get infected. So just really need to get the tick out, and its head and everything. And then it's also recommended to keep the tick in a plastic bag in your freezer. That way, if you do contract a disease, you can take that with you to the doctor, and it'll make it a lot easier on them to identify what you have. So preventing the disease, again, there's no vaccine, probably just because it's not super life-threatening. You can fight it off on your own. So the only way to really prevent it is to not get bitten by ticks. So insect repellent, long sleeves and pants, avoid woods and grass, stay on the path if you're going hiking. They also recommend wearing light colored clothing. That way it's easier to see the ticks since they're dark. And just basically never go outside ever again. Here are my sources. I hope you enjoyed it. Hope your finals are going well, and I'll see you Monday.